there's a lot of complications with surgeries. One of those complications is infection. You can't avoid it, even if you're the best surgeon in the world. You have to open that knee completely up to be able to take off the ends of the bones and put in artificial pieces to have that thing work better. It's very prone to infection. But one of the side effects or end results of infection could be amputation of the leg. Most people don't know that when they're signing up for that surgery. We do things that are not as invasive first, and that's what an integrated medical model does. Working with chiropractic, traditional medical people using very non-invasive, function-based remedies. And you get these patients who would not want to go to a chiropractor because of their bias, but they would get chiropractic in this setting. That's what we're doing. We're actually creating the environment where people can get things like chiropractic and like regenerative medicine, like physical therapy, all these different things. Whatever you want to put into that model is what you can put into it. It's basically creating a toolbox of function-based outcomes. You could put all different types of ways to work on people, like PEMF, which is pulsed electronic magnetic field, or different things like joint injections using things like hyaluronic acid or lidocaine or procaine, things that Janet Travell pioneered with President John F. Kennedy back in the 1960s. So we put these things in our practice. They're all function-based modalities, not symptom-based. Our goal isn't to get the patient out of pain. Our goal is to figure out why the patient got in pain in the first place, fix that so the pain goes away and stays away. So when you look at it, you go, okay, well, what's the biggest competition? We're in the physical medicine market. We're treating pain, physical medicine or orthopedic pain. Well, surgery is a candidate. Surgery is something that people could do, and if that would functionally correct it, but does it functionally correct it? Not necessarily. If you start to look at the stats, and don't get me wrong, there's a time for people that need surgery, but the rate that we do it in this country is so out of proportion. It should be that we do a conservative approach, and that's what the integrated model does. If you look at the stats of surgery, there's so many failed back surgeries that they now have a syndrome called failed back surgery syndrome. And I've seen numbers of 60 to 75% of surgeries on the back end up as a failed back surgery problem. So if you look at that, you go, that's pretty high. I think everybody agrees the outcomes of those surgeries are not really what everybody is looking for. And you can break that cycle. The earlier we get these people, the better it is. It helps them to get better and improves their body functionally, and now they're not taking drugs or getting surgery. So if you'd like to learn more about our functional approach to healthcare in an integrated model, go ahead and subscribe and drop a comment.